Have you been trying to get pregnant for a while and it's just not happening? Are you wondering if it's time to get medical help? Today, we're going to go over the reasons why you may want to see a healthcare provider, even if you haven't been trying for a full 12 months. Welcome back to Every Mama's Midwife. My name's Jess. I'm a certified nurse midwife and infertility mom, and I'm currently 23 weeks pregnant with an IVF pregnancy. I always knew I was probably going to have a hard time getting pregnant because my menstrual cycle has been irregular since puberty. I was one of those girls that would get my period and then it would disappear for 3 months, and then when it finally did come back, I would bleed for several weeks at a time. It did get more regular as I got older, but once I turned 30 and my husband and I started trying to get pregnant, I had already been tracking my cycle for several months, and I knew I would have anywhere from 24 to 36 days between periods, and it made it really hard to determine my fertile window. Most couples will get told to try for 12 months before seeking medical help, but hands down, the number one reason you should seek medical help, even if you haven't been trying for a full year, is if you're not having a consistent monthly period. If you remember back to my video about the luteal phase, or the second half of the menstrual cycle, I'll link that video here in case you missed it. Your period is triggered by a drop in progesterone that occurs about 14 days after you ovulate if you're not pregnant. So if your period is not coming, it's because you didn't ovulate. Sometimes I'll see women who have been trying to get pregnant for 12 months, but then when I do their initial infertility workup, they'll tell me they have only had 2 periods in the last year, which means they really only had 2 months or 2 chances to try, as opposed to someone who's having a consistent monthly cycle who would have had 12 to 13 chances to try. If you're not having a period, you're not ovulating, and that means you need to seek medical help even if it hasn't been 12 months. The second reason why you may want to consider an infertility evaluation, even if you haven't been trying for a full 12 months, is if you or your partner have any history of pelvic or reproductive trauma. For example, if you have a history of pelvic inflammatory disease, you could have scarring in your fallopian tubes that prevents sperm from reaching the egg to fertilize it. Maybe you've had severe ovarian cysts in your younger years that caused you to lose an ovary, so you're only working with one. Likewise for your partner, if he's experienced any significant testicular trauma in his life, he may want to get a semen analysis before it's been 12 months. I also routinely recommend semen analysis for men who have jobs where they have to drive a truck or a bus for extended periods of time, as that can cause the testicles to overheat and harm sperm. The third reason why you may want to see a healthcare provider, even if you haven't been trying for 12 months, is if you're 35 or older. The current recommendation is to seek help if you are 35 or older and you've been trying to get pregnant for 6 months without any success. I do agree with this recommendation, but I also feel like it sets an unrealistic expectation. If you're 35 and trying to conceive, it likely will take you longer to get pregnant than someone who's 20 or 25. This recommendation exists because at 35, we know you have a lower ovarian reserve, so if there is a problem, we want to make sure we get on top of it quickly so you don't lose your chance to get pregnant. It's also worth noting that if you're 40 and you want to be pregnant, especially for the first time, you don't have to try for any amount of time before seeing a doctor. You can seek help right away. The fourth reason why you should seek help with getting pregnant, even if you haven't been trying for a full 12 months, is if you've been previously diagnosed with a condition known to cause infertility. These are diagnoses like PCOS, polycystic ovarian syndrome, endometriosis, or an infertility diagnosis in a previous relationship. So I actually had an infertility patient who I started an initial workup on because she had been trying to get pregnant for 2 years, but then I didn't hear from her for a while because she and her partner had separated. So then when she was trying to get pregnant with a new partner, unfortunately, I was on maternity leave and she saw someone else who told her she needed to try and get pregnant again for a year, which I absolutely never would have made her wait that long. Fortunately, I found out about it because she came to see me a few months later because she was pregnant. So it all worked out. But I can't imagine how frustrated she must have felt when her concerns were dismissed that second time. There are some gray areas when it comes to infertility evaluations. For example, I tell my patients who are 34, I'm happy to see them anytime between 6 months and 12 months of trying. What becomes challenging as a healthcare provider is when patients want to do a full fertility workup before they even start trying, or if they've only been trying a short while. I recently had a patient come to me asking for a full infertility workup when she was 20, healthy, having a consistent monthly cycle, and had been trying to get pregnant for only 2 months. And sure, I can do some basic blood work, which I did for her, but a lot of infertility testing for women is really invasive and really expensive, and it's probably not ethical to do it for someone who hasn't even started trying yet. The other problem is that in the United States, most insurances won't cover infertility testing. If they do, you need a diagnosis code to order those tests under. You can't expect insurance to cover the tests just because. I hope you found this video helpful. Please give it a thumbs up if you did. If you're wondering what to expect at an initial infertility evaluation, I will link that video next. If there are other infertility topics that you'd like to see videos about, please drop them in the comments. I post new videos every week about infertility, pregnancy, and motherhood after 35, so make sure you subscribe and turn on the notification bell so you don't miss an upload. Thank you so much for watching.